Impacted wisdom tooth removal, 3D oral surgery explained. If you are facing an upcoming oral surgery appointment in the US or Canada, you know the fear that comes with your dentist saying your wisdom tooth is impacted. This hidden, misaligned third molar is more than just a nuisance. It's a ticking time bomb threatening your entire jaw structure and potentially your vital nerves. This 3D animation reveals the exact steps of the surgical extraction procedure, why impaction happens, and, most importantly, how to avoid the dreaded complication known as dry socket. An impacted wisdom tooth is one that fails to fully erupt through the gum line, often growing sideways or getting trapped against the second molar. This situation causes chronic jaw pain, increased risk of infection, and irreversible damage to adjacent teeth. Once diagnosis is confirmed by X-ray, the extraction procedures begins with safe and effective sedation. The oral surgeon first makes a small incision in the gum to access the tooth. In severe cases of impaction, the surgeon must use a technique called sectioning, carefully cutting the wisdom tooth into smaller pieces to ensure safe removal and prevent unnecessary bone loss. If seeing the precise steps of this oral surgery has helped ease your anxiety about the procedure, please take a moment to hit the subscribe button. Your support allows us to create more high-quality educational content about complex dental procedures. And since this is a universal experience, we want to hear your story. Did you have an impacted wisdom tooth? What was your dental surgery recovery like? Share your experience in the comments below. And please share this video with any friend or family member who is preparing for their wisdom tooth removal. Successful recovery is just as crucial as the surgery itself. The biggest risk is developing a dry socket, which occurs when the blood clot dislodges from the extraction site. Our animation emphasizes the importance of following post-operative instructions meticulously, such as avoiding straws and smoking. While rare, understanding the risk factors like nerve damage and how surgeons avoid it can give you peace of mind. By choosing a qualified oral surgeon and understanding the process shown here, you empower yourself for a smooth and successful wisdom tooth extraction.